Community Health Clinic was set up as part of a larger approach to improving engagement between Chorlton Good Neighbours and the local active case management team in response to our frustrations as a voluntary group about getting quicker support for some of the older people who we felt were struggling a bit. One of the other factors that I was hoping would happen is that it would raise the profile of the value of a voluntary group's approach to people. It values getting to know people and that instinctive knowledge about people, and from my point of view I wanted to raise that to have equal value to any clinical assessment that the nursing team might carry out. All of us have learned from each other, so that for me and for some of the volunteers we can see that the nurses are as passionate as we are about supporting the older people and getting the best for them, and I hope for them as nurses they can see the value of that very low-key, instinctive knowledge that the volunteers and staff have. The volunteers and staff are seeing the older people on a very regular basis and in lots of different settings, and I think for volunteers that's telling them that they're building up a relationship with the people, so that when they notice the slightest change they're monitoring it, and if the changes persist or people start to deteriorate even more, the volunteers are often the first people to come in and say to me, so-and-so's just not quite right.
We'd already had somewhat of a relationship with you guys that had been kind of there for a while, but something that we wanted to work on was how to improve our relationship in order to improve the patient care.
I wasn't sure how the clinic was going to run, to be honest. So I took a lot of guidance from Gilly and from Lisa. I thought when I came in here I built up a little bit of a relationship with yourselves anyway, so it was, in that sense it was easier for me to come in and extend that little bit of relationship with you.
Janet would come in on the Thursday coffee morning, and it's been transformational really, from feedback from the project team, from what's been working well and what hasn't been working quite so well. So what we've been doing is, to start off we had it where we'd had the clinic room and we have people at the coffee morning, so we do a mixture of seeing people separately but also seeing people in amongst everyone else.
It was a bit of table hopping, wasn't it, to start with?
Yes.
We sort of sat with them around the table and it was a little general chit-chat really, and that's how it sort of started a little bit, wasn't it? And then people wanted, a lot of blood pressures wanted to be done the first couple of weeks, wasn't there? Mm-hmm. And then maybe trust started to build up and people was asking to see us in the room. Mm-hmm. and the same people for first 3 or 4 5 weeks maybe, and then other people that hadn't sort of chatted to us wanted to start talking to us. So that's how it progressed really, wasn't it? And now everybody, I feel everybody thinks that we are accessible to everybody. If somebody wants to just have a quick 5 minutes with you, then they just grab you anyway, don't they?
Yeah.
So we don't just tend to see the people that are on the list. There is other people that we do see, but we may only have 5 minutes with them. They don't want to go in the room. They may just want to ask how they are or how we are, and we have a little chat that way. So that's worked as well, hasn't it?
Normally we see people in their own homes.
Yeah.
So I suppose
I think the disadvantage is we don't get a flavour of what it's like in their own home. We don't know how they live in their own home. So that is probably a disadvantage of not being able to see somebody in their own home. The advantages is that we're seeing a lot more people.
When you are going around to see people, you're actually building a rapport more quickly because people feel more comfortable, and so people do open up slightly better, don't they?
Yeah,
I'd
they
say. In terms of the community group, I think some of my learning is kind of leadership skills. So from your perspective, you're the community leader for Chorlton Good Neighbours, so it's interesting to see how you manage everything and manage the volunteers and the users. One of the other skills that we've learned is about having those challenging conversations, which has been beneficial, because in terms of different aspects of the project, at the start we wouldn't really say anything, would we? We'd be kind of a bit
Silent.
Right,
Silent.
okay. Yeah, but that's all right, isn't it?
and now I feel I'm able, well, I go through.
What do you think were the lessons you learnt from this project?
It's hard to go into a place where everybody knows everybody and just be a face there, but you know, everybody, volunteers, clients, have all been very receptive towards me and what we do.
Okay.
Yeah, people know my name now, and that's really nice, and it's very warm reception, I feel.
Definitely.
Yeah.
Feel like as part of the
Yeah.
community, really, don't you?
Yeah.
And as part of the group, when you
Yeah.
go in and see people in the morning, it's
Yeah.
morning to volunteers, people
Yeah.
recognise your faces,
Yeah.
they're getting to
You
know
get offered a cup
us.
of tea.
Offer a cup of tea, we get to have a little chat beforehand, see if there's
Yeah.
any problems, and then
Yeah.
with the users, you come in, when they come in, it's, oh, good morning.
Yeah.
So it's nice, it's lovely, and I think people think that we're approachable, which
Yeah.
is most important, and they feel like because it is less invasive setting, people wouldn't go to the GPs about certain questions because maybe they feel a bit, some people feel a bit daft, which they shouldn't feel daft about
Feel
such
wasting
things.
the GP's time, don't they?
Exactly, but in such a setting people open up more, and I think that's been one of the real positive things, hasn't it?
Yeah.
And it's been great that we've been able to have actual referrals from GPs.
Yeah.
We've had a couple of those, haven't we? And hopefully that will be something that.
I think it's just evolved, and it's evolved in a very positive way. It was all fingers and thumbs really when we started, and you know, Gilly was there to sort of manage us really, thank goodness, because I used to write everything down on a piece of paper, and Gilly says, well, why are you doing that? Write it down on the appropriate paperwork, and it just cut so much time. And it's just a learning curve. So.
What do you think are the lessons about working together?
It can be done. I think that's the thing. If you've got enough resilience and stamina and will, and you begin to trust each other, we can do anything. We've made a start, and hopefully we'll carry on. But you've got to have the will, haven't you? Yeah. And that initial relationship and the desire to want the best for your client group. So because everyone here, including the volunteers and the staff at Good Neighbours, because we're all seeking the best for our local older people, then there's no reason why a project can't evolve and be successful.
I agree, Helen. I think the first film that we did of Helen originally was about trust, wasn't it? That you mentioned trust and how important that is to working together. And I think that we've built that really, and I just see it as a platform now. It's not finished, it's a work in progress.